You have to understand that you are now doing the work of your pancreas.
Hi everyone, I'm Samantha Pervor and welcome to another episode of Let's Talk Wellness with Watsons. Today's topic is for those who have or know someone with diabetes. Mahirap na, especially if mahilig kayo sa sweets. But don't you worry because there are ways to help us manage diabetes. Kaya naman, we also invited a medical professional to help us dissect and understand what diabetes is all about and what we can do if we have it. But before we get into it, I'd like to invite everyone to like us on Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel for more health tips. Make sure to hit that notification bell so you're always updated too. Diabetes, medyo scary pakinggan, di ba? Parang bawal ka na kumain ng cake, bawal ka na kumain ng ice cream. So paano na pag may birthday or kapag may celebration? Hashtag fear of missing out, di ba? Let's all find out together because here with us to share insightful knowledge in managing diabetes is a doctor who also hosts Med Talk Health Talk. Let's all welcome Dr. Freddie Gomez. Hi, Doc. Welcome.
Hello, Sam, and hello to everyone watching. It's great to be here.
Doc, eto na, straight to the point. What exactly is diabetes?
Diabetes is a chronic metabolic disease characterized by an elevated blood glucose level. Now, ang ibig sabihin nito, Sam, ito ay isang chronic condition, meaning matagal na gamutan ito, at least 1 year or even more. Now, a metabolic disease means may problema ang katawan natin in harnessing the energy doon sa pagkain natin at maipasok sa ating katawan. Basically, there are two types. There's type 1 diabetes and type 2 diabetes. Type 1 is not so common. Normally seen ito with children and teenagers. What's important to understand, it can happen at any age. Now, this is more of an autoimmune problem, meaning our body attacks the cells of the pancreas by mistake. Those with type 2 diabetes ang mas common na type, Sam. This normally happens with those who are 45 years or older, those who are sedentary, wala masyadong exercise, hindi masyado gumagalaw. And the diet consists of a lot of sugary food, a lot of carbohydrates in their diet. Now, what happens here is that the body needs to produce insulin over and over again. That's why over time, napapagod na yung pancreas natin or that area that produces insulin. So eventually, it just nasisira na lang ito or hindi na nagproduce ng enough insulin. Napapagod na siya sa paggagawa ng insulin, Sam, or it doesn't even produce enough insulin at all. So what happens here is that those with type 2 diabetes now need to either take insulin or they need to see a doctor in order for their blood glucose level to be normalized. What insulin is, it's a hormone produced in our pancreas. Now, it's very important because this is what enables the energy from the food that we eat to enter our cells. Imagine it as sort of like a key that enables our cells to use the energy from the food that we eat.
I really like that analogy, Doc. As a matter of fact, it's like unlocking your energy. I'm such a sweet tooth pa naman. So goodness, if I had diabetes, how exactly can I manage it? And more importantly, is it true that you have to monitor every single day?
If you are diagnosed with diabetes by your endocrinologist, it is very important, Sam, that you monitor your blood glucose every day. You have to understand that you are now doing the work of your pancreas. So it's important that you know the levels of your blood glucose. Sometimes it's as few as twice a day to as much as 10 times a day, depending on what you and your endocrinologist discuss. What's good about this, Sam, is that you can do these monitorings of your blood at the comforts of your own home with the use of a gadget called a glucometer.
Thank you so much for clarifying on the importance of taking your blood glucose levels every single day. And by the way, I do have a glucometer right over here, handy dandy. And let's give them a really quick demonstration on how to use it effectively.
This glucometer is what records how much glucose you have in your blood. So what's important is that you get the test strips that's specific for the machine and cap it right away because it doesn't like humidity. So once you insert the strip into the machine, it will automatically turn on. Now from then, you can do the next important step, which is actually getting a sample of your blood using the lancet. So all you have to do is load it back and it will automatically prick your finger. So you have to set it up first by massaging your finger up to the end and then using the lancet to prick it. Now you will have a drop of blood for your test strip. So all you have to do is put it near the test strip and it will bring the sample in, and a recording of how much glucose you have in your blood will come out probably in a minute or 2 minutes at most.
Now that we know about blood monitoring, let's talk about another thing you mentioned a while ago, the medications. So what are the medications that we can take to manage diabetes?
Depending on what type of diabetes you have, type 1 or type 2,
okay.
This will be tailor-fit for you and you alone. So depending on the type of diabetes you are diagnosed with by your endocrinologist, you can either be given insulin injections, oral medications, lifestyle modification, or a combination of all three. Now, working together with your endocrinologist will enable the diabetic to get the best management and treatment for the current condition that they have.
Speaking of medication, there's a lot of news about diabetes medication being used as a platform to lose weight really fast. Now, super trending to sa feed ko, by the way, Doc. Celebs na biglang namayat. What are the possible effects of diabetes medication to our body?
It is not uncommon, Sam, for medications to be used off-label. Using medications off-label, such as diabetic medication for weight loss, without the supervision of a physician or a weight loss management specialist is very, very dangerous.
Wow.
These medications for weight loss were initially intended for those who are obese or those who have certain criteria that fit the medication of use. Now, some people use it maybe a little less fat over on this side for aesthetic reasons. You may not see the intended purpose by using these medications this way. So it's very important that you consult your physician, you consult your weight management specialist, or if you already have a prescription for this, it is always good also to talk to a pharmacist to learn more.
I couldn't agree more, Doc. As a matter of fact, it's always best to consult with your doctor kasi sila talaga ang experts. And of course, you can always talk to your Watson's pharmacists to learn more about your prescriptions. But for those naman who don't have diabetes just yet, what can we do to avoid it?
Well, that's a very good path to take because we always want to promote prevention rather than cure. Now, to prevent diabetes from happening, especially type 2 diabetes, it is always to be wary about the amount and the type of food that we eat. So we always want to eat a balanced diet. Maintaining a healthy weight is all about consistency rather than intensity. So taking a brisk walk for 15 minutes every day is much better than working out for 2 hours once a week. All of that is important, but we also want to make sure that we visit our doctors at least once a year, especially if you're 40 years old and older, to have a general checkup just to make sure everything is in check. And this will enable you to have a clear picture of your overall health and decrease those risk factors.
Thank you so much, Doc, for breaking it down for all of us today. And of course, sana marami kayo natutunan dahil ako, I've learned a thing or two. One way to prevent or manage diabetes is by being more mindful of our lifestyle and food choices. Simple swaps can go a really long way. So for today, let's play a game. The rules are very simple, Doc. It's multiple choice. Game ka na ba?
I'm ready, Sam. Let's do this.
Okay, first question. Which breakfast option is recommended for someone with diabetes? Is it A, sugary cereals, B, plain bread and eggs, or C, cheese desal and orange juice?
I think a lot of people take this in the morning, but the best answer here is plain bread and eggs. Now, the bread we want here is whole wheat bread because it lasts longer in your stomach. We feel full longer with that, and the eggs provide good amount of protein as well to decrease those insulin spikes.
Okay, let's move on to the second question. What is a habit that can help manage diabetes? Is it A, regular exercise, B, smoking, or C, binge eating?
Regular exercise is best. So keeping yourself active, engaged with physical activity will enable your insulin to really be at a good level. You can never do anything right when you smoke, and of course, you want to manage that binge eating as well.
Moving on to the third question. Ano naman yung habit that can develop diabetes? Is it A, getting enough sleep, B, drinking plenty of water, or C, sitting for long periods.
Getting enough sleep and good clean water is very good for you. Sitting for long periods of time decreases your metabolism, tends to increase your weight overall, leading to even maybe high blood pressure. The answer here is C.
That's true. A sedentary lifestyle is a no-no for those who might be at risk for diabetes. And lastly, alin naman dito ang healthier snack alternative for someone with diabetes? Is it A, candy, B, pizza with pineapples, or C, apple with peanut butter?
The best answer here would be apple with peanut butter. The apple here can provide vitamin C and some fiber, which can be good for you for sure. And the peanut butter here provides magnesium, and the peanuts here provide enough protein as well to last you your day. So the best answer here would be letter C.
Excellent choices, Doc. Ayan guys, I hope that you all learned something new today as much as I did. Thank you so much, Doc, for coming over and giving us useful tips and insights on managing diabetes. For more ways to wellness, Watson's has a wide range of health and wellness essentials, offers, and services. You may get them through the Watson's app or the 1,000 plus stores nationwide. And if you're looking for more information about diabetes medicine and other essentials, you can always ask your Watson's pharmacists. Don't forget to like us on Facebook, follow us on Instagram and TikTok, and subscribe to our YouTube channel. My name is Samantha Pervor, and this is Let's Talk Wellness.